What will your last 10 years look like? Will you be quick enough for a game with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average people will spend their last 10 years in sickness. Change your future that will make your health last. Here on The Christ Farmacy, your key to health and vitality.
This program aims to inform and provide solution to your health queries.
And it provides valuable health information and embraces a holistic approach to wellness by addressing physical, mental, social, and spiritual health that aims to empower individuals of all ages and backgrounds to take charge of their own well-being.
Mga kapaglaong, we will help you find out answers to your health concern. This is Kay Hespersera.
And I am Ray Tagalogon. Welcome to our weekly health program, The Christ Farmacy, the key to health and vitality. Kapaglaom, bisan kinsa nga babay aduna gayoy kabalaka mahitungod sa iyang panglawas. I would like to welcome all of you sa atong ika-23rd episode with our guest today.
Yes, and with that mga kapaglaom, as we start our new episode, I would like to encourage everyone, if you have your questions or gusto ba ninyong comment mga kapaglaom, you can comment sa ato ang comment section, and you can send your comment also to our hotline number 0970-077-7734. And since another episode na sa dato ang makatunan karon nga kabuntagon mga kapaglaom, we encourage everyone to please share this live stream aron na mabless ang inyong family and of course kauban inyong mga friends.
Yes, kapaglaom, it is with great pleasure again nga atong makauban ug atong i-welcome ang ato ang speaker karon, si Dr. Cherilu Nermal Fernandez, a distinguished expert in OB/GYN and a specialist in lifestyle preventive medicine. She will share to us valuable insights on the topic at hand. Please join us mga kapaglaom as we welcome back Dr. Cherilu Nermal Fernandez. Doc,
hello, Doc.
Good morning once again.
Good morning,
Yes.
Kapaglaom Kay and Kapaglaom Ray. And good morning, everybody, for tuning in to Because I Am Eve. You're welcome, and I hope you will learn something from what we're going to do today.
Mga kapaglaom, usa sa gikalangkuban sa itong programa is ang panghimangno. And speaking of that, it will never be complete ang atong discussion today if we will not seek and listen to a spiritual health tip. So, mga kapaglaom, the Christ Farmacy teaches you and hopes to help you about natural ways and to point us to the one and only source of healing, the greatest physician and Savior, Jesus Christ.
Okay, sa pagsugod mga kapaglaom, atong idako atong mga ulo alang sa atuang prayer pagampo. Let us pray. Amahan nga balaan nga na ikaw sa imong trono sa kalangitan, ani nasab kami magaduol ug magadangop diha kanimo sa imong gangaan sa trono sa kalangitan aron sa pagpasalamat sa paghangyo diha kanimo nga ikaw mudawat sa among pagpasalamat ug mga pagampo. Dinhi mga oras o Dios, kami magapangayo usab kapasilon sa mga sala nga pinapakyas kanimo sa unahuna, sa pulong ug sa buhat. Magampo kami nga ikaw magauban kanamo. Magapanalangin sa among programa ning dapit sa kabuntagon. Magatabang kanamo nga sa among pagsibya ni imong mga pulong, imong mga pagtulunan ug mga talambagan mahitungod sa mayong panglawas kini mahimong mudangat ngadto sa mga kasing-kasing sa among mga katawan nga nangandoy usab nga makabaton og mayong panglawas. Among ginampo special way si Dr. Fernandez sa iyang paghatag sa iyang mga insights ug mga talambagan. Ikaw magapanalangin kaniya. Salamat kayo nga ikaw nagaumol sa iyang unang kasing-kasing sa pagdugang sa iyang kaibalo kaalam ug nini Dios iyang gipagamit ang iyang kaibalo diha sa imong buluhaton, and we praise you for that. Magampo kami nga ikaw magatabang kaniya ug kanamo sa kinatibuk-an sa among programa karon. Lakip na sa umong kaubanan diri sa studio nga ikaw magahugpong kanamo nga kining programa magmalampuson uban sa pagdala og dungog ug himaya sa imong ngalan. Pinaagi sa gahom ug ngalan ni Hesus among personal ug bugtong manluluwas. Amen.
Amen. Thank you so much, Kapaglaom Ray. And this time, Paglaom, this growth in the uterus affects countless individuals and can have a significant implication on their well-being. Mga Kapaglaom, join us as we embark on a journey to unravel the complexity of our topic title for today, My, Oh My, Myoma. Wow, mga Kapaglaom, it's very interesting. And with that, we will invite you to listen another lecture from Dr. Fernandez.
Good morning! Welcome back, mga Kapaglaom. I learned something. I'm hopeful that all of us can learn from what I've been sharing with you. It's because I really want us to, especially women and even more especially for men, to be able to understand for women themselves and for men, either their sweethearts or their wives. So today we're going to deal with a very, very common problem associated with women. It is fibroids or myoma. So welcome today to another restful episode of Because I Am Eve. Eve, woman, the one that God gave to Adam to be his helpmeet. She was beautiful. She was perfect. But as time goes on, after sin, woman started to suffer. And down the line, as in 6,000 years up to now, women are now suffering from a certain malady that's very common. And that is fibroids or myoma. Now, the statistics and epidemiology, meaning ang kadaghanan ani how much we suffer, what amount of women or percentages of women suffer from this. But fibroids, they are the most common pelvic tumor. Baga, if a woman has a tumor in the pelvis, most likely that is fibroids. And it does not grow anywhere except in the uterus, okay? So fibroids grow in the uterus. But fibroids really, if you're going to the specific scientific term, fibroids are growth of smooth muscle cells. So kung asa man ang smooth muscle cells, a fibroid can grow there. But the tumor of the uterus, because the uterus is made of fibroid cells, of smooth muscle cells, when they become a tumor, the muscles, then they become fibroids. So it affects the uterus. No, fibroids affect the uterus. It affects as much as 70 to 80% of women. Okay? 70 to 80% of women age 30 to 50. So when you go into middle, lampas 20s, no, dito na dahil magsugod og magtukar ang uterus sa maghimo og fibroids. And majority of women with fibroids are without any symptoms. So wala sila kabalo. Actually na ko isa ka pasyente nga ang iyang fibroid dako gyud kay sa nga tanan. In fact, I have a picture that's almost like it here in my presentation na she did not even know that she had that fibroid. Kasi abi niya man good nga gatambok lang siya. Abi niya bilbil. Di ay to fibroid na dito, myoma dito. Ang tawag man good dito sa Pilipinas myoma, no? Pero the scientific term really is fibroids. But you can also use myoma. It's not wrong, you know? So, majority of women, 50% of them are symptomatic women. 50% of symptomatic women develop severe symptoms that have major impact on their lives. Only, you know, so, daghan kayo na daghan kayo, majority of women have this fibroid, you know, but only 50% that are manifesting can have severe manifestations or severe side effects from the tumor. It's not a lot. The incidence in Black and Asian women, so we Asians, we're very prone to it. Mga itong pud nga lahi, very prone pud na sila. So 2 to 5 times higher than the one that are the white people, okay? So, we Asians, we're prone to fibroids. Kalahi na nato na siya. And the age onset in black women is on average 10 years earlier. So, even with us, Asians, 10 years earlier. So, kung ang puti nga tao, a white person, Caucasian person, develops it at like 40, we develop it at 30. If they develop it at 50, we develop it 10 years earlier. So, it's really that common. We go forward, the body habitat is considered to be a predisposing factor. So usually kaning mga what they call this, mga nagasuffer og fibroid, mga on the big side sila, you know? Because I already said in the previous mga presentations nako nga kung nakay extra fat, ang imong extra fat magproduce na sila og estrogenic compounds, no? Estrogen of a little bit lower potency, pero estrogen nonetheless. Ya kung daghan kag estrogen, ang uterus manggod puno kay na siya receptors for estrogen. So mutubo day na siya kay maminaw siya sa extra nga estrogen that your body is producing. So the habitat which is medyo on the fat side makes you prone to have fibroids, okay? Women who weigh more than 70 kilograms are 3 times more likely to develop myoma or fibroids than women less than 50 kilograms. Okay? So, if you're less than 50, not so much. If you're more than 50 kilograms, then you have 3 times more chance of developing fibroids. They are rarely seen in premenarche. Kay wala pa man po siya estrogen. Ang bata, wala pa man wala pa garegla, no? So, wala pa kay siya dagan estrogen. So, you don't see it before menarche. Okay? But they enlarge during pregnancy. Kaya during pregnancy, musaka man ang estrogen. So, mo-enlarge siya during pregnancy. I've seen this over and over nga. Ang mga women nga na ay fibroid or myoma, when they get pregnant, their fibroids grow very big. So that they come, kanang maglisod din siya panganak, kaya nga ang fibroid will get in the way. Sometimes pod, ang fibroid, muilog sa blood supply niya. Ang bata, madehado siya sa blood supply. And then when a woman takes contraceptives, she makes herself prone. Kaya ang contraceptives have estrogen in them. Okay? And then, however, when you get into menopause, majority of the time, the fibroids will disappear slowly. Kaya nga no, wala na may estrogen. So it's very common during the reproductive life when estrogen is there. And when estrogen is predominant in your body because you're on the heavy side, you become more prone to develop it. Okay? The annual changes, the annual changes for inpatient, mga tao nga ma-admit tungod sa ilang fibroid has to be managed surgically is 2 billion hysterectomies. Okay? So, imagine ka, annual na in the entire world, we have 2 billion worth of hysterectomies. Kadaghan. It's not small number, no? It's not hundreds lang, kundi billions, no? Money spent in dealing with hysterectomies or fibroids. So this is what the tummy looks on the right of somebody with fibroids. These are not my pictures. I picked them up from the net. I'm not going to say that these are mine, but I said to you that I had a patient that had a fibroid as big as a 5-gallon paint bucket. Have you seen a 5-gallon paint bucket? Inana kadako, di pa gyud kasulod ang iyang myoma didto sa bucket. Pero tingnan ko, look at that. It can be very big. And this woman is relatively asymptomatic. Kaya nga lumaki ng lumaki. Nagdako. Nawa siya kabalo. Abin niya, gatambok lang siya. Nga nagani ko'y pasyente dito sa Palawan nga. Abi in town sa papa nga, wala gatugan niya, nga buntis ni siya. Kaya ganong dako kayo himtiyan. When she's not buntis, they came to the doctor, they came to me, and when I checked, she had a really big fibroid. Fibroids can grow very big and without even manifestations. However, pag nag-manifest ka, daghan problema, 50% have extreme problems. So what are the characteristics of the fibroid tumor or the myoma? Sa may characteristic niya? As I said, the correct term is myoma. Kasi scientific name ang good is, sa muscle is myo, no? the root word. So myoma, oma means body. So muscle, body. Myoma. Leo means smooth. So smooth muscle, leiomyoma. That's the correct term actually. But fibroids is fine. They arise from the muscle tissue of the uterus. They do not invade surrounding tissue or distant organs. So dili siya pareha sa cancer nga mutubo nya mo invade sa surrounding tissue like cancer. No, fibroid doesn't do that. Myoma does not invade tissue. It does not metastasize either. It's only localized in the uterus. They do not usually kill the person affected. Bisag nagdako na siya, usually dili na niya pat yun. It's not lethal, in other words, no? It's not mortal. Dili ka mamatay ani sa fibroids. However, they can cause pressure on neighboring organs or tissues. So if it presses on the bladder, ang imong sa Bisaya ang pangalan ani, basta bladder kanang giihi ba, kanang where your ihi is being stored. Kung ang uterus magsigig sakay sa bladder nimo, ang butangan sa ihi, pantog, okay? Sa pantog, mag-ihi yun na siya permanente, kay dili man mapuno ang pantog, kay nagbugat man ang fibroid dito. So gamay na lang ang capacity. So matingala siya, sige man siyang ihi, ano? Kay gamay ra ang capacity sa iyang pantog. Samantalang kung sa rectum na pud siya nag-lean and cause pressure, maglisod og libang pud siya, ma-constipated siya, or else kana ginagmay-gagmay lang ang iyang pagbawa sa iyang stool, you know, how he passes out the stool, how she passes out stool is affected. If it rides on the ureters that goes to the kidneys, ang ihi mo back up sa kidneys, unya mag-hydroureter na siya. So naay problema kung long run ma-affected ang kidneys food. So kung dili gani ni siya ma-check and then naa siya manifestations, problematic ang resulta kung naay manifestations. They can cause profuse bleeding. Kasi sometimes manggod, as we'll go further, the fibroids can be in any part of the uterus. And if they are located in a specific place, it causes profuse bleeding. And sometimes, kasing laki lang ng marble, as big as a marble, smaller pa. Pero nasa manggod siya sa lining sa uterus, sa kanang area gani nga ga-slough off, kanang sabihin natin, mura ga panit kada regla. And kanang nga lugar, kung naay fibroid diha, magdugo gid siya ng area, kay dili man siya makahil og tarong, kay dili man siya lining, kundi muscle siya. Tapos full of blood vessels. So, it can cause profuse bleeding. 2/3 of the masses may degenerate and cause problems. So, sometimes they're so big na walay blood supply sa sulod. So, mag-necrose na siya or mamatay na siya sa tunga sa fibroid. Sa kung nain patay within your body, it will release inflammatory products. It will cause inflammation in the body. Sometimes it becomes very serious kasi usay malata lang na siya. And kung dili siya ma-control, dili siya ma-covered or what we call this well capsulated, it can spread in the body or can spread in the bloodstream. So, problematic na 2/3 of these masses that are big, they can degenerate inside and cause problems. That is 0.3 to 0.7% of fibroids may degenerate. It's not a big percentage, but if it happens to you, I've seen this happen, and nahitabo pag yun siyang pregnant siya, nag-degenerate ang fibroid sa sulod. Na siya'y baby, 7 months pregnant, ang dako nga fibroid nag-degenerate during pregnancy. So we had to decide, what are we going to do? Take the baby out or take the fibroid out and save it's a difficult decision to make when you have a fibroid that is degenerating during pregnancy. I just am glad and proud to say that the Lord helped the baby survive this problem, no? We had to deliver the baby very premature, kay severe man gyud ang necrosis sa fibroid, nadako gyud kay siya nga kung kuhaon sad namo makabhak ang uterus. So problematic gyud, kinahanglan gyud kuhaon gyud ang bata. So muna, otherwise the woman will die. In a series of, it says here in our slide, in a series of 1,429 hysterectomies, Hysterectomy is the removal of the uterus for myoma. 0.49 or almost point, okay? Almost 0.5 were found to be sarcomatous. Very small, no? 0.5. 0.5, right? So less than 1%, right? It's 1/10 of 1%. Yeah? So 1/10 of 1% lang ang fibroid or ang myoma, mahimo siyang cancer. So it's but it's not, cancer does not develop overnight. It develops over time. I learned from my pathophysiology reading that when you die, manggani, you don't die now. You have been dying early. So when somebody dies, unless kung vehicular accident na siya. If you die from a vehicular accident, you died there. But when you die from chronic problems, you've been dying long time ago. Slowly lang na nahimong widespread sa imong body. So, ang imong heart, namatay ka sa heart, dugay na siya nag-suffer. Kung nakakay problema sa imong lungs, dugay na siya nag-suffer. Nagdaghan na siya hangtod sa namatay ka from the problem. So, this is it. See, it's only 10% of 1%. Oh, very small na siya, no? Mag-cancer na. So, we have here the types of leiomyomata or leiomyomas. So, you can see here that there are fibroids that are nakapatong lang sa gawas. No? You can look here at the top of one on the top of the uterus. It's like nakapatong lang na siya. Lihok-lihok na siya, ana. Okay? Ang problem, ana, dili siya ma-affected. Pero kay kung magbugat na siya, maibot ang uterus, yung mag-ingon-ingon, ana, na ang uterus, kay bugat naman sad pud ni. Usahay pud, mutuyok ni siya, na ma-strangle siya. Tapos kung ma-strangle siya, mahimo siyang mag-degenerate, unya magsakit, kay mamatay man ang fibroid. Napoy fibroid nga na sa gawas sa muscle, like below that one that's at the top, and then there's within the muscle, good. Within the muscle, wala kay problema. Pero naamanggoy uban nga naasag lining gyud sa uterus, no? They are in the lining of the uterus. So I said, those fibroids, kahit maliit lang siya, kahit na less than a marble size, pero kung naagid siya sa lining sa uterus, sa lugar nga magregla ka, no? Diha man magregla, diha pud magbuntis, diha mag-implant ang pregnancy. Pero kung wala, kung magregla ka, kana manggod nga area, very vascular na siya, daghan blood vessels, pero dili siya makahil og maayo. So, pwede yun siya mag-bleed profusely throughout the month. So, profuse bleeding, spotting, bleeding, continuously, hangtod sa ma-anemic na lang siya. So, you have to decide, sometimes, no, they have to decide to take out the uterus, maliit lang ang fibroid, ina na lang kagamay. May gani karon kay naa na sila way of going into the uterus nga pwede nilang ana-anaon ang fibroid kuhaon-kuhaonin. Makuha na nila ang fibroid passing through the cervix with a little scope, So, dili na nila kinahanglan kuhaon ang matres, especially in those that still want to get pregnant, that want babies. And there's some also of fibroids that can be in the opening of the cervix and can get in the way of menses, can get in the way of fertilization, can get in the way of delivering the baby. Sometimes mag-bleed sad na siya, sometimes mag-infect pud na siya. So these are the types of fibroids. So you call them subserous, the one that are under the lining outside the uterus, and you have intramural if they're inside the muscle. You have submucosal if it's under the lining or the mucosa of the uterus. This one is the one that can bleed. And then you have pedunculated subserosal, so outside of the matres, niya gabitay-bitay siya sa gawas, niya usahay mo turn na siya, mag-strangulate na siya. That's pedunculated, like the one in the top. And then you have down in the cervix, you can call that cervical leiomata or leiomyomata or fibroid, okay? So then you have the intraligamental. So there are some, like the number, is that the F1 there, yeah? F, it's inside the ligament, pero really that one came from the side of the pedunculated one in the side. So that's F, intraligamental. It has a little connection to the subserosal, which is from the outside of the uterus. So these are the different types of leiomyomata, and depending on where the fibroid is, it will manifest accordingly. So we have to know where it is located so that we know how to decide how to remove this thing. Okay, what are the risk factors? We will come back for the risk factors because there are so many of them, and we want to be sure that we know this, because if we have the risk factors, we might develop fibroids, since it's very common among us Asians. So stay tuned, we will come back later.
In a world that often attempts to confine and label her, Eve stands tall, unapologetically embracing her identity and rewriting the narrative with every step she takes. Join us in celebrating the spirit of Eve and women like her who fearlessly chart their own paths and redefine what it means to be whole, unbound, and truly themselves. Because I am Eve. Because she is you. Because she is all of us.
Welcome back. We're now going to discuss the risk factors. So here are the risk factors of developing fibroids. Okay, there are modifiable factors. Ibig sabihin nun, mailis-ilisan na nimo. You can work on them. Okay? And then there are non-modifiable. They are things that no matter what you do, you can't change them. Like for example, babae ka, mag-fibroid ka, na kay risk nga mag-fibroid ka, kay babae man ka, dili man po ka maka-change nga mahimo kang lalaki. They are non-modifiable factors. But let's first discuss the modifiable factors. Okay? The first one is childlessness. Meaning, wala ka panganak. Okay? Because manggod, there is a saying that says, a uterus that has not had a baby will comfort itself in a fibroid. Okay, it's very sad to say, you know. A uterus that has no baby, that has not developed a baby, will comfort itself in a fibroid or a myoma. It's because constantly manggud siya gabas in estrogen during the wax and waning of the hormones. So it's very sad, but that's a fact. Okay, when you get pregnant, you have more estrogen, so you make yourself more prone. So childlessness, you can work on it. You can have children, okay? Pregnancy, you can work on it. You may not get pregnant just enough. How many pregnancies not nga dili sad pug ka mag-pregnant, di sad pud ka magsigig pregnant. Kay kung mag-pregnant ka, di ba, mag-grow na siya. So dili ka mag-pregnant. So you know, it's life is just like that. There are complications that occur. There are factors that are affected. But you just have to choose what you need and what you want and what you can take and what risks you can take. The next one is contraceptive pills. So we talked about contraceptive pills, diba? Mag-take og pills para di ka mabuntis. Mura kag childlessness, right? And pills man could have estrogen in them. So kung may estrogen sa pills, then you get yourself prone to develop fibroids as well because of the estrogen. And then overweight. I can never overemphasize the fact that when you have extra fat in your body produces extra estrogen. So when you have extra estrogen, lahi pag yung kang Asian or lahi kang black, nagyo kay unsani ka nang mahimo, you have the propensity to develop a fibroid. So as much as possible, you can modify the factor of being overweight by working on it so that you lose weight and you're protected otherwise, okay? Then also hypertensive women, I tried to find the reason why. It's because probably that the factors that your body that deals with the smooth muscles during hypertension can also deal with the smooth muscles in the uterus. I'm not quite sure about that, but that's how I tuhog it. And hypertensive gani nga women, prone ni sila mag-fibroid. Okay? Then you have anovulatory. It happens man sad pod nga kung wa ka nag-ovulate, estrogen is predominant. Okay? So stress situations, high cortisol level, high estrogen level, these are making you prone to have fibroids. So you can work on your stress management baga. You have to be careful with how you deal with stressors So that you don't need to be like that all the time. O stress kayo ko, dili ko we can deal with stress. Women, we have brains, two sides of the brain working. So when we decide we can deal with stress, we really can deal with stress. We can actually deal with stress better. However, because of our hormones, we're prone to depression or anxiety even more because of the hormones. So there's a blessing and there's a downside to it. But when you're less stressed, when you deal with your anovulatory cycle, irregularize na yung regla, dili ka mag-prone to develop fibroid. The next one is poor nutritional habits. You don't eat right. You always eat fatty food. You always eat high-calorie food. You make yourself prone to develop, because you will, kuhan man good. When you eat the fatty food, the high-calorie food, you tend to gain weight, okay? So be careful with the food you eat. If you have rich food, rich meaning in nutrients like vitamins and minerals, the green, the phytochemicals, etc. like that, they will keep you from developing fibroids. Then of course the environment. This thing I have to deal with. You said, actually I know this to be true. Because when I was practicing in Palawan, these very rich women who have very expensive perfume, they come inside inside my office, no? Nya gapangalisbog yun ng pagkahumot gyud kaayo. And then wala pa gani sila nagsulti, kabalo nako, kani nani dysfunctional uterine bleeding. Oh, kani na siya fibroid. Mga ina na ba? Humot lang daan kabalo nako kay ngano ang perfumes, like the bee. The bee is attracted to the flower. Kay the flower is releasing the pabango, no? So, ang pabango is the same way as us. It's like sort of like estrogenic, helping our body become ready. And then it's released into the air and the bee sees it like that. So, when we pabango ourselves, ala, kanarabang, shhh, anak yun, dagang yun kayo, perting humuta. You are making yourself prone to having estrogen. Because this is, have you seen the patalastas nga, ang lalaki nga axe, nag-spray siyang axe. Yung mga babae, gagukod-gukod sa iya, inanasad po na, no? When girls make themselves very sweet-smelling, the boys are like bees. They come and follow, okay? It's just like that. However, these things make you prone to develop fibroids, okay? And also, kaning water bottle. Ang water bottle, it has the plastic. Many times, the plastic has BPA, and BPA is estrogenic. Si kitag inom og water bottle noon, ang water bottle ga-release na siya BPA. Okay? And BPA is like estrogenic. Ang lata pod, canned goods, ang lining sa lata, kuha na siya. Estrogenic sad pod na. So, we watch, that's why gani our food should be as close to nature as possible. And when you buy, mas maigi na lang bumili ka ng water nga naa sa gikan sa filter. Kaysa sa magbili kag water bottle nga kanang by itself. Labi nagmainitan ang imong water bottle, labaw na gyud na siya. Kay mag-leach man ang chemical sa tubig nya, imnon nimo na siya. So you don't want water bottles, that small water bottles, especially kung nainitan. Kita mga bata na to, ang mga high school, mga college, nag-PE sila, ibutang nila ilang water bottle nga plastic sa gawas na initan. Agoy, nag-leach gyud ng chemical sa tubig. O giinom. Muna nga itong mga bata pa, nanay mga dysmenorrhea nga severe, nanay mga problema nga dapat raunta na siya para sa 30 or 40 years old. Karoon na sa mga bata. Kaya tungod, gainom na sila, pahumot pa yun. Agoy, samot na. So we have really to be careful. Now we have the non-modifiable. We cannot change it. Because kalahi na to, na Asians ta. And then napag yung hereditary, kalahi, the mother had it, the grandma had it, the daughters will have it. It's sort of like that. Okay? Because our genes are passed down from generation to generation. And epigenetics also has a task in doing this. So the grandmother did not take care of when she was pregnant, her daughter will have the same thing, and her daughter will have the same thing. So we really cannot do anything about it. Kaya non-modifiable na siya. Pero di ba, you know very well that this mga genes na to manggod, they are like the bullets in a gun. Okay, so you have bullets in your, let's say your revolver or your pistol with cylinder, with a like that. Our genes are these bullets in the gun. Pero dili man na mo fire ang gun kung dili nimo i-pull ang trigger, di ba? So lifestyle man good ang imong pangkinabuhi, lifestyle, right? How you live your life, what you eat, what you drink, how you sleep, these things like this, they are the one pulling the trigger. So, bisag kalahi na ko nga na kaliwat nga fibroid, kung gakaon kog sakto, gatulog kog sakto, dili ko overweight, dili ko hypertensive, I'm able to manage my stress, I will not develop it. Because the genes are the bullets in the gun, but our lifestyle are the ones that pull the trigger. So, you don't want to pull the trigger, right? We don't want to develop fibroids, especially if we're working on a child. Okay, we want to get pregnant. So we're talking about manifestations. We alluded to this a little bit already, but let's discuss it even more. Okay, so they have two pictures on the left here. You have the different locations of the fibroids on the front view and the side view. So bleeding, okay, bleeding especially if the mass is in the submucosal type. Okay, if it is of the submucosal type, nasa lining of the uterus, near or around the area that is vascular, very rich in supply, then mag-bleed ang babae. So bleeding is a very big manifestation. Another one is pain. Pain, especially if the mass is heavy, tapos iyang na siya, tapos mag-twist pag yun na siya, no? So mag-necrose na siya or mamatay, mag-degenerate na siya kung naka-twist, okay? So painful na siya ang fibroid. Sometimes mubalik masad, so dili na sad siya sakit. Mag-twist na siya depending sa atong activities, no? Pain. And then you have infertility. So, depending on where the fibroid is, it can leach the blood supply towards your baby, or it can be in the area around the part where the implantation of the ovum is. Dili ka mag-pregnant, mag-infertile ka na lang dayon. Kay kanang dayaon mo gud ning fibroid, iyang mangkawaton ang blood supply padulong sa iya, di na makaadto sa baby. Usahay pod ang similya gikan sa lalaki dili makaabot sa fallopian tube padulong sa uterus para maka-fertilize sa egg kay ngano nagbaraman ang fibroid. So it can manifest, fibroids or myomas can manifest as infertility. Then obstruction, okay? Obstructive problems. The ureters can become problematic. The urine can back up to the kidney, and the kidney can be destroyed. Okay, and also the bowels, including ang paglibang nato, maapektahan na siya. Ang pag-ihi nato, maapektuhan. Ang kidney nato, maapektuhan. Pati ang paglibang nato, maapektuhan. So we really do not like to have fibroids, no? It's cumbersome. It's problematic. Pero it's not. I can just say na it's dili siya ikamatay nga sakit unless kung nagkuhan siya, nag-necrose siya. But you can always get yourself checked to check whether you have it. Now, the cause of or the pathophysiology, how does fibroids come about? So I have said this a little bit already. The cause of uterine leiomyomas or fibroids is truly unknown, although their size appears to be related to estrogen and then a little bit with progesterone and growth factors. So, you know naman that when you eat a lot of chicken, ginahatagan magud ang chicken og ang kuno growth factors, di ba? Para mudako ang chicken og paspas kay aron ma-harvest na nila. So sige tagkaon og chicken, makaon na tong growth factor, ang growth hormone. So ang imong uterus nga bloody kay na siya, angiogenesis na siya, bloody, mutubo siya paspas kay nagkaon man ka growth factor, growth hormone. So dili gyud ta magkaon og mga inaanak kung natay fibroid. I'll tell you a story, okay? I had 3 little fibroids, less than 2 centimeters. And my experience is kung mag 6 centimeters na ang fibroid, lisod na siya i-lifestyle. Pero kung below 6 centimeters, most likely we're able to deal with it. But I had 3 little ones. And then I would juice myself, I would behave myself, I will eat properly, I'll sleep properly, I'll sleep early, I'll try to stress manage, etc. Mawala na siya. Magpa-ultrasound ko, uy, nawala ng fibroids. Kampante na sad po ko, no? kaon na pud ko, kaon na pud kog manok. After 6 months, oops, ultrasound, nanapod siya. Do the right lifestyle, they disappear. It's real. It's very real. Because these things, the modifiable factors ni siya, no? You can really change your modifiable factors and you can choose not to pull the trigger in your gun. Yeah? And then this if you add more bloody, kung bloody gani ang supply, if the fibroid is growing near blood vessels, it will grow very fast. Okay? Then you have, let me go back, sorry. There is a genetic component. We know that, right? It's genetic. Mga Asian mga black people, we're prone to it. You cannot do anything. It's just in our genes. And leiomyomas are increased estrogen and decreased progesterone sensitive and are found to have increased numbers of estrogen receptors. So, kung kita mga Asians, no, we have the propensity to develop more estrogen receptors in our uterus. So, ang atong lifestyle, kaon tag chicken, nga na growth factor, gapahumot ta, wala tagatulog og tarong, wala tagakaon og tarong, we deliberately make ourselves prone to develop fibroids. It's very sad, but it is true. So, we have the management. Now, judicious observation. So, judicious observation means magbantay lang gyud. Dili nga hara-hara pag adto sa doktor na ay fibroids, no? Na-diagnose nga na ay fibroids, operahan na ta kadayon diretso. No, there is what they call judicious observation. So it's just follow up kay ang fibroid man good usually slow ni iyang growth. Pero kung naa siya close to the blood supply or kung ikaw nagapahumot or naamoy kaliwat, so paspas na siya mag-grow relatively to somebody who doesn't have these factors. But you check every 6 hours. You have an ultrasound X to check whether it's growing or not. So if there's bleeding, you also if it's bleeding, if you are manifesting with bleeding, you make sure that you eat green leafy vegetables or you take your iron supplement para dili ka mag-anemic. Kay ma-anemic man ka magsige kag bleed. Okay? So, you work on the bleeding and endometrial abnormality, whatever man the problem is, you have to take care of it. So that dili ka magsigig bleed. So, judicious na siya na type of management. Dili siya invasive. Another one is give time to try natural or lifestyle interventions. Because this mass doesn't grow fast. Okay? So, you have enough time to try. And it's like, kumbaga, dili ko makigpusta. But I know that if they are not really very big and you do lifestyle, they will disappear because in my life, I have seen it happen several times. Okay? So they have the medical or allopathic therapy. Allopathic means the regular doctor. Okay? So the medical or allopathic therapy, they give you medication to shrink the mass. Okay? So they can give you a medication that gets in the way of the production of estrogen. Okay? Estrogen man is the one that's causing it to grow. So, ilang ihatag sa imo is anti-hormone para against estrogen or against your producing estrogen. So, mag-shrink siya kay walay estrogen. Okay? So, it makes you menopause during the time you're taking it. Can you imagine, when you get to menopause, mag-osteoporotic ka, magkunot ka, walay lami, you have sexual contact with your husband, saputon ka, etc. So, medical allopathic therapy is not really always the best way to go. So, you have to think of what you're supposed to do. So, then we have different medications, so many of them. GnRH, medroxyprogesterone. This one is, medroxyprogesterone is Provera, anti-progesterone, RU, 486, etc. Androgens, aromatase inhibitors, never mind those, They are what the doctor knows to give you. These things will cause you to menopause, in quotes. Pseudomenopause, you call that. And then when you have pseudomenopause, then the mass will not grow or the mass might shrink. Okay? So continuing on our management, you have surgery. Surgery is myomectomy, take out the myoma or the fibroid, or take out the uterus. So sometimes when she wants to get pregnant, if the young woman wants to get pregnant and she has fibroids, they only take out the myoma. and then hope that it will heal well, and then she still can get pregnant. Pero kung ayaw na niya maging pregnant, kasi naman 40 years old na siya, na siya tulo ka anak, upat, she doesn't need to get pregnant anymore, then we do hysterectomy. Okay? And there's some women who cannot deal with hysterectomy, kaya kung matanggalan sila, magkuhan sila, they think they're not complete anymore. So kung ganun naman, di mag-myomectomy na lang siya. So there are pros and cons for whatever management of surgical management you want to do. But it's very true, okay? According to Richard Telind, he is the doctor of gynecology surgery. All indications and contraindications in medicine are relative. So this is the indication. Fibroid is an indication for hysterectomy. Bleeding is an indication for hysterectomy. But whether it is an indication or a contraindication, it is relative. Meaning, pwede dili, pwede. Okay, dili. O gusto, o dili gusto. Okay? A fact that is especially true when one considers hysterectomy or myomectomy. So we consider nimo whether you're going to do hysterectomy or you're going to be myomectomy kasi there are different ways to manage it, okay? So consider it. These managements are relative. So you go to somebody, a doctor who is more or less empathic with you, can sympathize, can help you try the normal things or the lifestyle, etc. so that you don't need to go through surgery because once you breach the pelvis gani, ako na kuan undertaking, and you develop adhesions many times after you operate. So here is a myomectomy. You can see down on the picture, the doctor is trying to take out the fibroid. You know, they call this myomectomy. Kuhaon lang ang myoma. Sayon man ni siya ikuha ang myoma, imo lang itusok yung finger. It's like what they call this? It's like peeling an egg or peeling an orange. That's myomectomy. And hysterectomy is this. On that you have take out the top of the uterus, you leave the cervix behind, or you take out the entire uterus. Okay? So you have different types of hysterectomy. And sometimes they leave the ovaries behind, or they take the ovaries as well. So that's the menopause na gyud kag tarong ani kung inana ang mahitabo. So minimally invasive or non-invasive therapy. So kasi magpag-surgery man gani ka invasive kay na mosulod gyud ka sa lawas, no? So naay uban nga dili kanang gamay lang nga invasive or non-invasive therapy. So they call this the uterine artery embolism or occlusion. So what they do is they inject something through the artery and they clog the artery so that there's no blood supply to the area of the fibroid na namamatay ang fibroid. And they have MRI guided focused ultrasound so that they can bring the medication directly to the fibroid so that the fibroid will die. So here we have a picture where they're injecting a medication into the area where there is a fibroid. And then like that na siya, no? Then naa sila kanang beads is the medicine. And it clogs, it's not really beads, okay? But it clogs the blood supply going towards the fibroid and the fibroid will die. Kasi walay blood supply. Napod sila ultrasound guided. So the ultrasound will go there and cause it to, ultrasound will kill the cells and the cells will die. Okay? You have also, so we come to the time when it is, what do you call this, very important that one who has a fibroid should think twice about whether she's going to go to have surgery or not. But in properly selected women with symptomatic fibroids, the result from the selected treatment should be an improvement of the quality of life. You don't operate on a woman basta lang ganahan. Ang doktor baga, og ikaw sad pud nga naay fibroid, dili lang gyud basta lang magpa-myomectomy ka or magpa-hysterectomy ka. You must be really sure that when you decide to have an operation, it should be an improvement of the quality of life. So with that being said, brothers, sisters, my dear kapaglaom sisters, I hope that when you think about this, common man gud ang fibroid. Maghuna-una gyud tag maayo. Kay naman goy uban nga chance, there are other ways to deal with fibroids other than operations. You can talk about it, you can read some more, because what I'm giving you is very superficial, not really very all inclusive. Pero I hope that you stay with us so that you can learn even more as we finish this. Stay tuned. So, we have another very important principle to think about in the management of fibroids or myomas. It is the predicted benefits of alternative therapies must be carefully weighed against the possible risks of the above treatments that we said. So it's very important nga hatagan gyud kag choice nga because manggo the alternative therapies can work for you. So you have to weigh that, di ba? Kasi di ba the quality improvement of life of the woman when you do a surgical operation or whatever, is the life of the woman going to get better really? Is it really worth the operation? So the predicted benefits of alternative therapies, kaya ang alternative therapies man good are the natural treatments that we do that we're trying to espouse. To sleep early, eat properly, drink a lot of water, be in the sunshine, stress management, eating properly. These are alternative therapies. You hear this all the time, but kanang ginabungul-bungulan lang nato ni sila, pero tinuod ba yun ni sila? Because our bodies have been made that way to answer, to properly work when we put gasolina in a gasolina car. You do not put diesel in a gasoline car, right? You're going to destroy the car if you put diesel in a gasoline car. And the opposite also goes through putting gasoline in a diesel truck. So it cannot work like that. But our bodies are like putting gasoline in a gasoline truck when you're doing alternative treatments. It is just but logical. So I share with you one text that I really like to put into our hearts. It says, "But God hath chosen the foolish things of the world to confound the wise." So, kung ano na, tubig lang na, tulog lang na, vegetarian? Okay. In the world, foolish na siya. Wala na siya'y bali. What? God has chosen the foolish things of the world to confound the wise. So, naayura di siya. Kalamansi ang gihatag. And God hath chosen the weak things of the world to confound the things which are mighty. So, kaning simple lang ang mga treatment, kung kabalo lang yun mo magamit ani, kung kabalo lang yun mo nganong maayo ni sila, kini sila ay makahil sa imo, no? And then, the base things, walang katore-tore pa sa Tagalog, the base things of the world and the things which are despised hath God chosen, yea, and the things which are not, to bring to naught the things that are. So, ang ginunan sulti nga, kini, ginalait-lait lang ning mga lifestyle. Pero sa tinuod, kini nga mga butang, mo'y makasulti nga, these are my laws and my statutes. If you follow, I will not give you the diseases of the Egyptians. Dili ka magka-chronic disease, di ka magka-fibroid, di ka endometriosis, menstruation problems. Like that, God says, do this, and you will be well. So He says, come to me, all ye that labor and are heavy laden, and I will give you rest.
Thank you so much, Doc, for your invaluable lecture. Your knowledge and your dedication have undeniably enriched our comprehension of this very important topic. Mga kapaglaom, let's now move to our question and discussion. We have some questions here and we would like to take a few moments to address them with Dr. Fernandez.
Yes, alright mga kapaglaom. As we will start ang atong discussion, I encourage our viewers to have your thoughts, no? If you have to share your thoughts, questions baka karong adlaw, so with your reflection sa atong comment section on Dr. Fernandez lecture. So now, Doc, now we have one of the questions here ang ato ang i-discuss is, are fibroids or myoma nga ingon nila dangerous or fatal?
Fibroids or myoma are regularly not dangerous or fatal. They are benign tumors of the uterus, di ba? So, dili sila regularly nga mag-cancer. In fact, kung mag-cancer, sa mga tigulang lang na siya. And 0.09% lang or 1/10 of 1% ang mag-degenerate siya to cancer.
So layo ra kayo.
Very, very small ang chance. And yet, when you still have fibroid and you go into menopause, you still have to check. Di ba? Kay every year, dapat ka mag-check whether you have it or not anyway, right? But if you have it, maybe it would be really just better na mag-check ka. But really, it's very nil. Gamay ra gyud kay ang chance nga mag-fatal siya.
Okay.
Yeah.
So at good point sa murag, it's a kind of good news no nga information
Yes.
Doc nga kay dire man ko sa Pilipinas when we heard labi na sa mga babae kana bitong makabati sila word nga myoma, mura bitong para nila it's cancer. So
no,
it's
it is not a
non-cancerous.
cancer. It's not. It's a benign tumor.
Okay.
But it can grow big, really big. And then it can cause obstruction and pain.
Alright, so if ever, Doc, kanang dako na gyud siya, medyo kuha na gyud to, uneasy na gyud to siya.
Oh, yeah. Pero kasi the growth is very slow, so naka-adapt ang babae sa weight.
Oh, okay.
Kay kung ibutang na nimo overnight lang yung ana, nidako siya even within weeks, no? That would be very hard on the girl with all the fibroid that's growing. But because it takes a long time for it to grow, it's very slow in growing. Nagpabaya na lang gyud ka. Kung nagdako na imong tiyan nga mura kag buntis na imo lang gipasagdan.
okay.
It's something that doesn't come overnight.
Okay. So one point Doc nga atong ipadako karon is a myoma or fibroid is not cancerous.
No, it's not cancer.
Okay, so dili siya angay ikabalaka. But kinalang gyapon siya hatagan og panahon.
Yes.
Okay.
Yes.
Hindi siya dapat kabalakan pero og magdako na murag dira jud kang trigger because you're in pain with ba.
Yeah.
So
Your
hatagan
pain.
siya og hatagan siya og pagtagad.
Yes,
while it is
supposedly.
still young.
Yes.
Okay.
So it's like we really need to have ourselves checked now and then. That's the norm. I mean, nowadays, because we're barraged with a lot of in things that make us get sick. So dapat good take care lang gyud ta.
Okay. Doc, another question, Doc. Since we are talking about you, about Eve, by the way.
Yes.
So we are
Yes.
talking this kanang maghisugop ng mga kababayan na magod. We will be looking forward sa ilang pagka womanhood
Yes.
na magbaton sila kanang makabaton sila mga anak. Now, talking about myoma or fibroids. Fibroids or myoma, can this or makahinder ba kani siya sa possibility nga mag-pregnant ang usa ka babae?
Oh yeah. First, okay? First, a woman may not get pregnant because the fibroid can get in the way of the pagsulod sa similya padulong sa ovaries. Okay?
Block siya
Yung mo block siya.
sa passageway.
So, pwede siya mahimong blockage na ang sperm dili nakaadto sa egg para ma-fertilize siya. Okay? So, dito pa nadaan, dili na siya mabuntis. The second one is, it can be in the lining and it can irritate the lining. So, kung ma-irritate ang lining, dili mabuntis ang babae, kaya dili man maka-implant ang egg. The next thing is, kung maka-implant man gani ang egg, naay competition for blood supply. So, instead of the blood going to the baby, it goes to the fibroid. So then, mahimong dili na makagrow ang baby or mahimong intrauterine growth retardation na pwede sad mahimo mamatay ang baby, pwede mag-bleed ang fibroid, so mawala ang baby. So yes, fibroids can get in the way of pregnancy.
I see.
Delikado gyud gihapon siya.
delikado
Murag
gyapon.
mahadlok
Tapos,
sa
naapag yun,
abot na ana.
pag panganak pag yun anak niya, kung gablock siya sa pag-agi sa ulo, dili makaagi ang baby gihapon. Dili pud maka-contract og maayo ang uterus kay naay mga fibroid. So, it really does affect pregnancy and
So,
delivery.
So ang myoma de Doc, yeah, of course it can happen anytime.
Yes.
So during example sa ang usa ka babae mabuntis na. Pero during sa iyang pagkabuntis wala pa mitubo ang myoma. And then sa imong size gino nga very slowly mali siya motubo no.
Yeah, but during pregnancy, it will grow very fast.
Really?
Because of the estrogen in pregnancy. So sometimes gani mag-degenerate siya, as in the lecture. Sometimes so I had a patient that had a big fibroid and she got pregnant.
Okay.
Nagdako gyud ang baby hangtod 7 months, no? Pero pagka 7 months, nag-necrose na, namatay ang sa sulod sa fibroid, and severe gyud ang pain ana. So what are you going to do? Are you gonna save the fibroid or are you gonna save the baby? So sort of like it's a dilemma. What are you going to do? Because when you lap mango the fibroid, masira ang uterus, masira ang bahay bata. Diba? So, i-deliver ang baby para makuha ang fibroid. Marang inana na siya. Yes, yes. And the baby was very premature, but survived.
Okay.
So, kung earlier ang necrosis sa fibroid, mas problematic, di ba?
So, nana, yun din, no? Kakuan mga kapaglaom ang medyo wingon ka nga marag dili kay kakulbaan but pag imo din siyang pabayaan mo ni siya dako kayo pug kaging damage.
Makomplikado na.
Okay.
So, Doc, we are talking about here myoma. So, ang pagkuan na Doc, ang how fibroids or myoma treatments affects the chance of Eve to get pregnant. Kung halimbawa Doc kanang usa ka babae na siya treatment sa kuan, na siya treatment sa iyang myoma, shall we say, na siya mga tambal. Could that medicine affects the chance of Eve, of women to get pregnant also?
If during the time they're taking the medication, if they were given medication, mga GnRH man na siya, mga hormones na siya, dili siya ma-pregnant habang gina-take niya na.
I see.
Because it's going to cause her to go into menopause. So, meaning, di siya magregla. Sa panahon nga naga-treat ka, dili siya mo regla. Or kung mo regla man siya, dili siya fertile, kaya di siya mo ovulate. So when the medical treatment will not affect pregnancy because she cannot get pregnant at that time if she's taking the medications. But if you're going to do surgical management, like removing the fibroid, of course, the chance of getting pregnant increases. But it also depends how big ang kabhak sa fibroid, sa uterus, nga dili na hinon siya gyud ma-pregnant kay nakabhak man ang uterus, no? Or asa dapit man ang fibroid naglodge. So you have problems with that. So it should be dealt with nga gamay pa siya para dili siya magproblema ang pregnancy.
Dok, naba mo kanang specific asa na OB, no? Kanang specific nga centimeters unsa na kadako ang kinahanglan kung para sa inyo recommend nga kung naaman mo ana tanggalo na siya
o tanggalo na siya.
Unsa na nga mga kuan na ba CM na ba?
Yes, there are. You know, regularly mag 6 cm kuhaon gyud na siya. Pero kung ako gusto ka mag-pregnant, kahit maliit, kuhaon na gyud na siya. Yeah.
Okay. So mo na so actually kapag lang rin mo na naas na ako kay na mga kababayan na nato karon nga kay since gamay pa, feeling nila makaya pa nila i-treat to siya.
Yeah, you can treat the small ones.
Alright. So, unsay mga kanang nabay natural thing nga himuon pa na nila? Or pwede pa ba nimo ubson kay siyempre wala pa siya abot og kanang like yung gi-mention nimo Doc nga 6 cm. Siguro na pa sa mga 4 or 3. Unsa may
you can
pa.
You can by lifestyle.
Movable pa ba na siya? Humok pa ba? Ana ba
no? No, it's hard. It's hard. Mura na siya. Ang feeling sa fibroid murag kuan na siya, murag batikulon nga luto, gahi, no? Muscle man good siya, smooth muscle. So, pero you can take it out easy, basta small pa siya. Mas maliban sa, you can do lifestyle in order, I told it in the lecture, na in my experience, I was able to lose out it. You know?
Yes.
Pero naon yung gigoy propensity, kay nitubo good, so nagigoy propensity.
So, ato balikon, Doc, no, emphasize nato karon unsa gyud dining cause kanin magmayoma gyud ta?
Okay. Pointing a finger to the direct cause is not yet really actually known. Pero it is affected by the increase of estrogen in the body and an increase of estrogen receptors in the uterus. On top of that, stress. You know? Okay. So, mo nang makakuan. Yes.
Always naman ako mamit ka ng mga...
Because me, nalusaw gito nako. Yan ni adto man ko sa States adto. Nanubo na sila. Nanubo gyud hangtod na I had to have it taken out within 2 years. So mga gagmay na, nawala na siya paglakaw na ako sa States, you know? But being in the States nga stressful kayong kinabuhi, within 2 years, I had to come back to the Philippines to have it taken out.
Alright. Do kanang paunsa nimo siya mahibalan, example as kani kita mga kababayan maka-feel lang mata ba nga hala basig na nay something wrong sa ako unsay na manifestation ganang ginagmay lang nga kay balo ka nga I think I have symptoms nga gusto ko magpa-check because murag feeling nako na something ana unsay.
Okay, first and foremost, the feeling is not always the truth. Feelings are deceiving. But however, sometimes man good, we as women, we have like what you call this kanang mga intuition gani, no? Pero it's really always better to get yourself checked regularly, you
Yo
know.
po siya, Dok, no? Kay dili pareha sa mga uban bitaw nga mabalaan nato ba nga ang isa sa mga cause kay kanang usay mag-ihi ka kay murag na something kay kato bitong time to open nakatry ko katong cyst ba. And then isa sa kong mainumduman ato kay taud-taud manghihi wala pa kay ko nakabot sa kuan taud-taud ko manghihi taud-taud manghihi and then that time mo to pag check na ako mo to siya pero gamay pa lang siya and then the more nga mas stress ka mas muda ko siya.
Oh, yeah.
Para ganana pud
Kasi
ba?
pressure man good. Di ba, ang fibroid, depende yung asa dapit siya nakalodge, mo manifestation niya. Kung na siya sa taas muscle in the fundal area, dili kay na siya mag-cause of problem. Pero kung kanang pedunculated, gabitay siya, or in the lining siya, mag-manifest siya. Pero regularly, kung small siya, dili siya mag-manifest. Pero bleeding,
Okay, bleeding.
severe pain during menses, it can be managed. So, always magyud. Basta out of the normal gani. Kasi supposedly, we're not, except for the bleeding, we're supposed to feel okay. But once it's ang atong diri, associated na with discomforts, but check na lang para sure.
Yes, yes. So, muna mga kapaglawom, no? Take note of that.
So not necessarily, Doc, nga ang kato ring Myoma sumala sa mo na mention a while ago. Correct me if I'm not mistaken nga ang Myoma there is asymptomatic.
Majority of the time, it is asymptomatic.
Majority pero not all di ay.
Yeah, not all
okay.
are asymptomatic.
Okay. Kay basig katubugong pangutanan ni kuan ni kapaglaom kay kaganina nga basig nagtuo lang sila nga wala pero after all
Buo di ay siya ba?
Oo.
Nagbuo
No,
di siya.
it's sometimes you know your body
Yeah.
more than anybody.
Yeah, sakto yun
Diba? So kung you feel something different, there must be something different, diba?
Yeah, evaluate your lifestyle then.
Yes. You can do lifestyle first. Kaya kung nagtarong ka,
Lifestyle,
tapos na okay siya, then okay.
Oo.
If nagtarong ka, wala ra gyapon, there must be something.
Mo ba tong
There.
imong gi-mention ka ganina nga when you took that juicing and
Yes.
then murag inanay siya nawala pero may balik kag kaon og manok
Ibalik na
hibalik
pod.
og tubo.
Yes.
So
Kinahanglan more on fiber pod ba?
Yes, food. Because fiber man good pulls the cholesterol from your intestines or the fat from your intestines. So, iyang i-pull down para, and then cholesterol to cholesterol man good is the backbone of estrogen. You know, so,
okay.
of the hormones. So, kung wala gani backbone is cholesterol, dili magsaka imong cholesterol.
Okay.
Okay.
That's all right.
yeah, thank you so much, Doc. No, our time together has been so enlightening.
Praise
So,
the
Doc,
Lord.
this time, mga kapaglawam, let's hear from our WMC Western Mindanao Conference Health Director for his spiritual health tips.
Mayong adlaw kanatong tanan mga kapaglaom. Salamat sa atong pagsunod kanunay dinhi sa Christ Farmacy. Alang sa atuang spiritual tips, si Mrs. Ellen G. White nagaingon, one of the strongest temptations that we met is on the appetite. Kini magud ang atuang appetite mga kapaglaom, mao gini siya pinaka kusugid kayo nato nga ato ang tentasyon. Kay mao kini siya ang nagdala kanato og daghan nga mga balatian. Gani si Ginoong Hesukristo gitintal pag-una diha sa pagkaon. Kay nasayon ang Dios nga kini nga pagkaon dinhi ta mapukan ug dinhi usab kita ma-strengthen. Ang balaang kasulatan nagaingon dili lang ang tao mabuhi sa tinapay kundi sa matag pulong nga magagula sa baba sa Dios. Mateo 4:4. Musa makaigsoon kung kidya adunay mga balatian, ilabi na sa mga kababayen-an, adunay mga mayuma, dunay unsa pa sa ilahang lawas, labi na sa atong gisgutan karon nga tupiko, ang Dios nagahatag sa mga original nga mga pagkaon. Kag kung atong sundod lang ang iyahang mga kabalauran, ang pagkaon sa original nga pagkaon, sa prutas, sa mga utanon, kini makapalikay kanato sa mga balatian. Gani, usa sa hinungdan nining mapurma sa lawas sa mga kababayenan diha sa ilang uterus kining mga mayuma, usa kini sa hinungdan sa pagkaon sa mga karne. nga sa original wala unta kini gitugot sa Dios apan sa nagligid ang kapanahunan aning kalibutana nahimo ng staple food, nahimo ng pagkaon kini nga mga red meat kining gidili unta sa Dios apan unsaon taman nga mao naman kini ang trend karon busa mga kapaglaom balik ta ato gihapon nga kaunon ang original nga mga pagkaon sa Dios. Genesis 1:29 mauni ang original nga gihatag sa Dios nga atong pagkaon to fuel our body nga malikayan nato ang mga sakit, malikayan nato ang mga diseases forming nga mapurma diri sa ato ang lawas. Kay kun kini atong kaunon atong kinabuhian ang prinsipyo nga gihatag sa Dios kanato nga dili lang kita mabuhi sa pagkaon ug mga lami aning kalibutana kay ato mangog yung nahuna nga lami kining mga bag-o nga mga pagkaon karon nga musulod sa ato ang baba sa atong ginhawaan ato ni siya nga kontrolon. Kung mahimo labi na sa mga kababayen-an balik ta sa original nga mga pagkaon kay mauni siya ang pinakanindot ug labaw sa tanan duol kita sa Dios mangayo kita sa iyahang tabang mangayo kita sa iyahang kusog nga kun kita dili ganahan niining mga pagkauna hatagan ta sa Dios ug changes sa ato ang taste bud sa ato ang baba nga kining mga butanga malami ug manindot nga atong kaunon aron nga kining mga disease forming nga na-contribute ni ining atong mga modern nga mga pagkaon karon mawala kini. So mga kapaglaom, ang Dios magahatag kanato sa kusog. Ang Dios magahatag kanato og kusog nga malikayan nato ang tentasyon nga sama kang Ginoong Hesus sa diha nga gitintal siya didto sa yawa sa kamingawan. Ingon siya nga ang tao dili lang mabuhi sa tinapay kundi sa matag pulong nga magagula sa baba sa Dios. So kung adunay ka struggle kapag laom, sa imong kaugalingon, pangayo ang presensya sa Dios. Pangayo ang iyahang gahom, pangayo ang iyahang kusog, aron maghatag kanimo og kausaban, maghatag kanimo og kaayuhan sa imong mga balatian, ug labaw sa tanan, mahimsog ang imuhang panglawas samtang mga kinabuhi nining kalibutana. Ang Dios magapanalangin kanimo.
Thank you so much, Pastor Glendon, for inspiring spiritual health tips. And this time, alang sa atong pagtapos, let us hear and give the time to Doc Fernandez para sa iyahang takeaways.
Okay, my friends, my dear mga kapaglaom, there is always hope. My, oh my, Myoma, you don't need to be like that, okay? You can be happy because you can deal with this thing. It's like we can deal with all our troubles. As women, we have strength, we have fortitude, we can do better. So we don't need to baby ourselves because we are strong. The Lord made us so, and He gave us all the health loss so that we can be the best for Him.
Amen.
Salamat kay Doc, no? Salamat kay sa Ginoo nga God has given you the wisdom.
Oh,
and
praise
that
the Lord.
we are also blessed, and even our viewers were also blessed. With that, mga paglaom, to God be all the glory. Ang among pasalamat ug kalipay sa inyong pagpakiuban kanamo sulod sa usa ka oras sa pagtuon unsaon pagkaabot ang maayong panglawas ilabi na kanimo Eve, mga kababayenan.
Yes, daghan kaayong salamat mga kapaglao. Magkita-kita na usab kita sunod nga higayon alang sa ato nga programa. Stay tuned with us mga kapaglao. Every Friday 11 a.m. to 12:30 p.m. Only here in our program, The Christ Pharmacy, the key to health and vitality.
What will your last 10 years look like? Will you be quick enough for a game with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? time to decide. The average people will spend their last 10 years in sickness. Change your future that will make your health last. Here on the Christ Pharmacy, your key to health and vitality.